Hello, my name is Kathy Head, and I am a Doctor of Nursing practice student at the University of South Alabama. I am in the Adult Gerontology primary track. My focus is on adult wellness and obesity management. This video is a presentation of my scholarly project. The title of my project is Integration of Obesity Awareness and Diabetes Prevention in a Community Clinic. Obesity is not addressed consistently in the primary care setting as a precursor to diabetes. Patient-centered care focused on obesity risk factors and addressing prediabetes earlier is important in altering the course of diabetes. The prevalence of obesity and the increase in prediabetes rates from 6.2% in 1994 to 10.9% in 2010 is evidence of the strong correlation between obesity and prediabetes. 1/3 of patients diagnosed with prediabetes will develop diabetes without intervention. In addition, obesity is the strongest predictor of type 2 diabetes. The purpose of the Quality Improvement Project was to integrate a system change in a primary care clinic in order to consistently address the risk associated with obesity and prediabetes and engage the patients in making a behavior change. Major strategies for Healthy People 2020 are disease prevention and elimination of disparities. The Quality Improvement Project was implemented in a community clinic for the uninsured and low income. The clinic structure and needs were assessed in developing the project to also support effective, efficient, patient-centered, and equitable care as outlined by the Institute of Medicine. Evidence-based practice was the basis for the development of the protocols within the Quality Improvement Project. Goals were determined, outcomes assessed, and the project was evaluated. The project was integrated at the Charlotte Community Health Clinic. The clinic is a nonprofit community health clinic for uninsured and low-income residents of Mecklenburg County. The primary patient base is Hispanic and African American, and over 50% of the patient population is obese. The clinic has a specific diabetic clinic once a week, and admissions to the diabetic clinic have increased by 40% in the past 8 years. The clinic data supports the need for the Quality Improvement Project when considering that non-Hispanic blacks have the highest age-adjusted rates of obesity at 47.8% in this population, followed by Hispanics with 42.5% in this population, and non-Hispanic whites at 32%. A 10-question survey was conducted to better understand the organizational culture. 14 providers and staff responded, and 2 of the questions are included here. Only 16% felt comfortable addressing obesity, which correlates to the research of obesity being inconsistently addressed. 91% stated an action plan would be helpful in addressing the risk associated with obesity. The integrated theory of health behavior change supported the project, and it is an integration of multiple concepts from previous health behavior theories. The 3 main constructs are knowledge and beliefs of personal health, self-regulation, and social facilitation. Individual knowledge and perceived health risk are important in creating a positive health belief and increasing self-efficacy. A positive self-efficacy is the belief that one has the ability to self-regulate one's own behavior to achieve a designated goal. The relationship between the theory concepts and understanding behavior change defines this theory. Increasing knowledge and understanding one's own personal health enhances self-regulation and engages the patient in developing the process for change. Additional concepts support the integrated theory of health behavior change. The goal-setting theory proposes that the relationship between goal specificity and difficulty has a linear correlation with the degree of self-efficacy achieved. Patient-centered education allows increased self-efficacy as the goals are created with greater patient specificity. Improving self-efficacy has been shown to have a positive effect on diabetes outcomes. Patient-centered care and communication also decreases low health literacy, and this is important in creating equitable care in the clinic population. Motivational interviewing is a patient-centered counseling style and has been shown to facilitate behavior change and reduce barriers to obesity treatment. A meta-analysis of behavior change models utilizing motivational interviewing demonstrated positive outcomes and rated high on grade of recommendation, assessment, development, and evaluation. The Academic Center of Evidence-Based STAR model was used to support the translation and implementation of the Quality Improvement Project. The ACE is a 5-star model describing a conversion of knowledge. The meta-analysis of behavior change models was refined in the summary stage. Protocols were developed based on the evidence-based research, and the project was integrated over a period of 12 weeks. The process and outcomes, specifically weight, hemoglobin A1C, and self-efficacy, were evaluated to determine the impact of the project. Assumptions for outcome performance measures for the Quality Improvement Project include a statistical significance in hemoglobin A1C, weight, and self-efficacy. 18 patients between the ages of 20 and 65 were enrolled. The criteria for the project was a body mass index greater than or equal to 30 and/or prediabetes, defined as a hemoglobin A1C of 5.7 to 6.4. Self-efficacy was measured pre- and post-intervention, and a personal action plan was reviewed at each visit. Educational modules and goals were determined by the patient. Each visit consisted of patient-centered discussion, goal setting, and educational modules. Setting goals at each visit is correlated with a higher degree of self-efficacy. 6 modules were created and included the titles What is Prediabetes?, Basics of Food Balance, Mindfulness, Helpful Tips, Exercise, and Reading a Label. The picture on the right is from Mindfulness. All of the modules were 8 to 12 slides on a 6th grade level based on the Flesch-Kincaid readability scoring system. The personal action plan included a section with common themes or barriers related to obesity. At each visit, the participant would choose a theme and determine the focus of the discussion. Modules were provided to facilitate behavior change by increasing knowledge and changing the participant's perception of their health. Engaging the patient increases self-regulation and self-efficacy. Self-efficacy was measured using the Weight Efficacy Lifestyle Questionnaire. This questionnaire measures self-efficacy by measuring the participant's perceived ability to change his or her eating behaviors in different situations. The questionnaire contains 20 items on a Likert scale from not confident to very confident and has 5 subscales. The subscales relate to different eating situations, and they are negative emotion, availability, social pressure, physical discomfort, and positive activities. All scales have a high internal consistency. In analyzing the data from the project, significance was set at an alpha level of 0.05. A two-tailed t-test was used since pre- and post-intervention data was compared. Cronbach coefficient alpha for internal reliability for the Weight Efficacy Lifestyle Questionnaire pre- and post was 0.887, indicating high reliability. Pre- and post weight and waist circumference was statistically significant at 0.035 and 0.003 respectively. Hemoglobin A1C was not statistically significant. The total score of the Weight Efficacy Lifestyle Questionnaire was statistically significant at 0.011. as well as 4 of the 5 subscales. Physical discomfort was not listed here as it was not statistically significant. The project outcome data are consistent with motivational interviewing and patient-centered care. The improvement in self-efficacy is supported by patient-centered visits. Participants stated the visuals, accountability, and motivation were most helpful. A limitation was the small number of participants, as only 12 completed the entire project. Although the hemoglobin A1C was not statistically significant, this project was only 12 weeks. Scholarly nursing encourages the development of innovative methods to improve the patient experience and enhance outcomes. The clinic has adopted the modules, and there is a set of 6 modules in each of the 9 adult patient rooms. An algorithm was created to direct patients to the content in each module. The process utilized in the quality improvement project could be generalized to other practice settings. I would like to thank Dr. Joyce Varner, my academic advisor at the University of South Alabama. I am grateful to Dr. Varner for her dedication and passion for teaching. I would also like to thank Dr. Denise Howard, my mentor at the Charlotte Community Health Clinic. Dr. Howard has a strong understanding of organizational systems thinking and quality improvement project implementation.